I'm Angelia Foster, and I'm the Chief Administrative Officer here at Marshfield Medical Center, Beaver Dam. We are so excited to be able to celebrate our 100th anniversary and roots in our community. I wanted to take a moment to introduce what you're going to see next, which is a video we have put together with members of our community, former board members, former employees, and current staff and providers as well. We hope you'll take a few minutes and watch and learn a little bit more about the last 100 years of Beaver Dam.
What people always ask me all the time is what was the area like? It was just brush and woods. So I mean, there were some clear-cut areas, but most of the people had to clear the areas themselves with hand axe and saws. And so that kind of leads us up to the medical part, is what was one of the major accidents that people had. It was being injured with an axe. And you had people coming from different areas of the world, and they may not have been familiar with all the tools they needed to build a house, and lots of injuries. And most of those injuries were taken care of by just, kind of home experience, where people had dealt with those kind of things in the past. No doctors. It wasn't for quite a few years until our very first doctor came to Beaver Dam. And up until the early 1900s, we didn't have a hospital either. All right, after going for over a year, the St. Stephen's congregation formed the Deaconess Association with the intention of purchasing the former Percy Lamoureux home. And Percy Lamoureux was connected with Monarch Range. And they used his home originally for the first hospital. And it was quite an ornate home and fairly large. So before an actual structure was built, they used the Lamoureux home. And that was very common. Just as I mentioned, the first hospital was in a home. The McClure residence, which was purchased in the 1920s, which is right next door. That building is still there, as the hospital has all been torn down now for future development. But the McClure residence was purchased in the 1920s to be used as a home for student nurses. It was used by the hospital for almost 80 years and is the hospitals themselves. Of course, we had the Catholic hospital in the present location of the hospital today, but we also had the Lutheran hospital as well. And they were built by religious congregations, and each one was really kind of their own. And what I mean by that is many times people would not go to the other hospital. If they were Catholic, they wouldn't go to the Lutheran hospital, and vice versa. And so that was a major problem over the years. Even if you live nearby, and I've had people tell me that even on their deathbed they would not go to the other hospital. So even if they were just at death's door, and they would say, well, we could take you, you live a block away from Deaconess Hospital on the lake. No, they weren't going to go there. And so that was something that the community really had to work on when they started deciding on putting the two hospitals together.
And I thought it was interesting in that I stood on the lawn and watched them dedicate St. Joseph in 1933. And I was a medical transcriber. The hospitals needed to be accredited, and they had to develop a medical records department. So she started it, and she was a tremendous boss. Charts used to be filed in envelopes, and envelopes that had writing space on the front. Then when I started there, my first job was to learn the language or the terminology. So I got to look at the chart, interpret what it said, and then write it on the outside, and that's where I learned to spell it. Why did I choose?
I know.
Should I tell her why? Because we needed the money. And I drove 12 miles at the various times to be there for 65 cents an hour. Then my boss got cancer, and she was off for a month, so then I got $1.
I'd like to point to one watershed event in the past that was extremely important, and that is the merger of the two hospitals, St. Joseph Hospital and Lutheran Hospital. That was about a year before I came to town. But it was still a very traumatic feeling among all the people who were working at the hospitals or who strongly supported one hospital or the other. I believe that the vision, the courage, and the decision that made by those people who were involved was extremely important, because this community could certainly never have supported two fully staffed, fully equipped hospitals in today's healthcare arena. It would be easy to say that construction of new facilities was important, but actually I enjoyed working with the employees far more. Not just that having a good time with the employees, but witnessing their commitment to the highest possible quality of health care that they thought this community deserved. I saw that in everybody. It's easy to think of a hospital as doctors and nurses, but a hospital is also made up of a clean and safe environment, which means maintenance, housekeeping, laundry, and those services. It means the pharmacists, the technologists in radiology and in the laboratory. It means the people who work with paper. It means the people who prepare the food. It means everybody. And we had thousands of employees during the years that I was here who regularly demonstrated a commitment to do the very best job they could. People asked me what was my job at the hospital, and I told them it was twofold. The first was to prepare the hospital for the future, to decide with the board what were we going to need in the future, 5 years from now, 10 years from now, or even further, and to prepare for that. The second part of the job was to decide what was needed for current operations, and that was that we needed to have every single employee have the right tools, the proper equipment, and the experience and training to use those so that they did their job perfectly every single time. 90% or 95% isn't good enough in healthcare. We strove for excellence at every opportunity, and that's the thing I am most proud of in working with the employees of this hospital. In my first year here, we had an awards program instituted for the employees, and every employee was given an award for years 5, 10, 15, and those services. Somebody once asked me at one of those banquets early on, what are you going to do for Elaine Kirschberg? She started here when she was 15 years old, and she could work 50 years at the hospital before she retires. And I rather flippantly said, anybody who works here for 50 years gets a new car. And everybody remembered that and reminded me of that over the years. I'm happy to say that when Elaine Kirschberg finished her 50 years, we did indeed present her with a brand new red Chevrolet convertible and a parking spot in which she could store it every day as she came to work. That was one of the things that really stood out as the way we were as a hospital. We also had a very strong group of volunteers. The volunteers are extremely important. They make our patients and our families feel more comfortable while they're in the hospital. They help by directing traffic, by carrying flowers, with a smile, a pat on the back, any way they can.
During that time of exploration of where we wanted to be, we learned about Beaver Dam's remarkable feat of joining the Lutheran Deaconess Hospital and St. Joe's Hospital. A Lutheran hospital, a Catholic hospital, formed a non-denominational one, which was very, very far ahead on the curve. Rural hospitals about the size of those were failing regularly. To staff 2 emergency rooms and 2 surgical staffs and 2 OB suites, and it was very challenging, and it was so wise of the community to join the staffs and have the acute care delivered at St. Joe's, which then became Hillside, and the long-term care to be delivered at Lakeview, a beautiful setting for that. So I was impressed, as was Sherry, and the kids came along whom we would visit, and they loved the park systems and the community and the lake. And so for us, it was a wise choice, and it turned out to be the right one for us. And I practiced at a remarkable time of change. When I came into medical school in 1965, that's when Medicare was passed as a law. So I never practiced without it, but that it was at the very start of my medical experience. And then I was in Beaver Dam when HMOs became a part of our world. And I can tell you, in about an 18-month span in that decade of the 80s, the physicians in Beaver Dam and the surrounding area went from being almost every one of us in private practice to being employed physicians, part of one of the large groups. That was dramatic, and it was very fast. It was a big change. Many good things and some that are more challenging. And then in the 90s, the electronic medical record showed up, which has really been in many ways very helpful for quality control and compliance issues.
Lakeview was, as they said, everybody was a family. So it was a family for the residents, a family for the caregivers, and that made us all one powerful unit for each other. And it didn't make any difference what position you held. They were all equally important.
Yes. For me, I think it was May 1994 when we moved Lakeview over to Hillside Manor. And we made all the plans, the staff made all the plans themselves, and it went very smoothly. Yes.
Yeah, that was a big deal,
That
moving all
was.
them people, 103 people in
Yes.
one day.
I agree, one day. And believe it or not, we got by without any cell phones or internet.
That's true.
We did. It was a fantastic move. And other hospitals and nursing homes came to us to see how did you do this tremendous move. So we had a pretty good aim out there for ourselves. Back and forth from Hillside Manor back to Lakeview to pick up the next load.
And they had a direct route.
Right.
Yeah. And they had an ambulance on standby in case that was needed. Yeah.
And there was staff stationed at the hospital in the units where the residents were going to go, and staff over at Lakeview to bring them over.
Then we had volunteers
Yes.
in each room to guide each resident to the room they were going to go to. So it was not a scary experience for anybody. It was very positive, very heartwarming, and exciting for the residents. I'm Gail Hope-Henshaw, and I was one of the founders of Meals on Wheels in 1973. And Meals on Wheels worked out of Lakeview Lutheran Hospital because we had a dietitian, Blanche Colvin, and she felt that there weren't enough people in the city receiving adequate nutrition. So that's how it really got started. We found volunteers to be drivers, and they would come to the old Lakeview Lutheran Hospital and drive under the canopy and pick up the meals. So when we started, we did lunch or dinner and evening meals.
And the hospital has made about 12,000 meals a year for all of the clients. It's really a lot of meals.
Speaking about family, when we merged with Lutheran Hospital, it was a very, very difficult time for everyone, both from each hospital, because each person had their job that they were comfortable in and secure in, and their co-workers. So it was very uncomfortable the first, I would say, months to years before people finally trusted each other, and a lot of them became very good friends over time. But at first it was like, this is how we do it, no, this is how we do it. It was a really tough time, but everybody merged together and became good friends and able to work very well together. Out that we had just everything you could imagine. We had all different kinds of surgeries, and we were way ahead of a lot of the rural hospitals around. And I found that out when I went to seminars, because we were one of the first smaller hospitals in the state that did laparoscopic surgery. And people at these conferences were asking me, when we were networking over lunch or whatever, you know, what it's like to take care of these patients. Did we think it was a good idea? Did we think it was a bad idea? So we were always, you know, right there with what was going on in surgical procedures and equipment. Way back when I first became a nurse, cataract patients were on bed rest. They had sandbags to their heads. We had to give them a bed bath. They couldn't get up to go to the bathroom. They had to use bedpans. They were in the hospital probably 3 to 5 days with total patient care. Now it's an outpatient procedure, and people have very little as far as limitations.
In 1986, we wrote the policies for home care. She wrote them and had piles all along the floor, and I typed them. Now, we were in a cubby hole off the main lobby of the hospital, and I had this ancient typewriter that I had to write the policies, and it was terrible. So Jane sent me, she heard me complaining enough, she sent me to the stationery store and bought a new typewriter. And that's how we started. Meeting all these families through home care was just an unbelievable experience. They were so grateful for home care, and I had home care for my husband, so I know exactly how it worked. They were loving, and they still are a loving bunch of girls.
To come into home care and hospice, because what we do is so unique to what everybody else does, because we don't have any support. We're kind of just us out there, and you kind of punt a lot because you don't always know what you're walking into. You don't know the situation, you don't know the equipment. Technology has changed a lot. Computerization was huge to make our jobs easier, because otherwise you had little paper charts with everybody. Everybody takes turn being on call. You'd get called out in the middle of the night, and you'd have to drive to the office, get the little paper chart, figure out who the patient was, what they needed, drive to their house. We didn't have GPS. We didn't have cell phones. My husband bought me a cell phone, and it was a bag phone. It was like this square. That was and then didn't we have one for the office?
We did. We had
to
check it out.
Check it out because there was one.
If we were on call.
And there was no GPS, and you'd get a page. Dr. So-and-so wanted you to call him. Dang, I'm halfway between Randolph and Beaver Dam. What should I do? Should I go back to Randolph, or should I go to Beaver Dam? Because inevitably, you're needed in the opposite direction of where they want, because you had to find a payphone.
Okay. Kids Care came to be in 1989. There were 2 houses over located on the hospital property. Since then, starting in 1998, we've been at the old Medical Associate building, where we are currently providing care.
14 years ago from today, or this year, we've added our 4K program into our facility, and that has been a great success.
Kids Care does not close because of rain or floods or snowstorms. Since we provide care for the hospital, who work 24/7, we are here 5:30 in the morning till 5:30 at night, making sure the doctors, the nurses, the cooks, the housekeeping get to do their jobs.
How the system really took a look at creating a system from birth to death. We have everything from the birthing center to kids care for our children to attend, all the way through hospice and our long-term care and CVRF programs. So I think we've always kept in mind it is a whole life cycle. That
was back when we had the old hospital before it was taken down. When there would be real heavy rains, it would flood, and they would have this alarm go out, and they would start sandbagging the back entrance where the employees came in so it wouldn't flood out. I don't remember if it was a CT Yeah, but it was so it wouldn't flood imaging. So maintenance and Rod and those guys would be sandbagging like crazy. So the water, and one time when I came, the water was actually pouring down the hallway.
I have a somewhat similar, I worked over at Lakeview, at the Lakeview building, which was long-term care at that time. And it would rain so heavy, we would have water coming down the walls. But no matter how difficult that building may have been to work in, the people really pulled together. We enjoyed working with each other. I mean, we would do fun things that you can't do these days because of different regulations. You know, Marshfield being a very large system, it's brought some great benefits. I mean, to weather a pandemic and keep our doors open has been, you know, a feat, because we would probably have not been able to do that with staying independent with the supplies and all of that type of thing.
I wanted to work at a place that was considered rural and served a rural community. There's something about the rural community where you know the people that you work with, you know the folks that you serve, and it has that friendly small town feel. And I get that feeling every single day when I walk the halls and I see the staff members, the teammates that I have worked with now for almost 16 years, and the patients and our visitors. So to give that friendly welcome, I want them to feel at home, just like I do.
I joined the board because I felt it was so important to us to have access to local care, not having to drive out of town to Madison or Milwaukee to get the care that you needed it when you needed it. And we were fortunate to have this hospital here. We've done a remarkable job of staying as an independent community hospital for over 100 years. We were fortunate to form a partnership with Marshfield Clinic, and that will give us the ability to bring even more care locally and keep us moving forward for the next 100 years. My father was also a board member and was in fact one of the leaders in the merger of St. Joe's Catholic Hospital and the Lutheran Hospital in 1972. So it was a real honor for me to follow in his footsteps and to be chair when we decided to merge with Marshfield Clinic. It's something that I cherish, and the picture of my father on the wall signing the documents for the merger in 1972 is something that's a very special memory to me, and something that I remembered every night that I sat on a board meeting and worked towards the same goals that he worked towards.
What a great story we just got to watch. 100 years of us being here to care for our community. Thank you to the former and current providers, staff, board members, and community members who've helped us to so eloquently tell the story of the last 100 years of care. As we think to the future, Marshfield Medical Center Beaver Dam looks forward to being a regional destination for healthcare, and we look forward to being here in 100 years from now to celebrate again together. Thanks, and have a great day.